Ask any retiree what really keeps them up at night. It's usually not, did we save enough money? But it's, what if one of us gets really sick?
Healthcare in America is complicated, it's expensive, and honestly, it's the biggest hurdle stopping people from quitting their jobs before 65. And today, we're gonna tackle that beast, healthcare.
And lucky for you guys, we've tried just about every one of these over the last several years. We've had the gold-plated employment healthcare plan for many years. We've looked at COBRA. We've done the faith-based sharing programs, and we've also done the ACA Affordable Care Act Marketplace.
And right now, we're currently sitting here uninsured. We're going to explain how we ended up here, why we're taking this risk, and the options you need to know about.
So let's rewind. Like most people, we've had that healthcare coverage for years through my employer. You don't realize how good that deal is until you leave. You kind of take it for granted. The company pays a huge chunk of that premium and it just magically disappears out of your paycheck and you end up not even realizing
That's gone.
what just happened.
These are the golden handcuffs. Many people stay in those jobs they hate just for the health insurance. But when we decided to make the leap toward our own money quest, we knew we had to cut those cuffs off.
So when you leave the job, the government says you can keep that same insurance for 18 months and you get that big like 35-page paper in the mail and it makes it sound really good. And I think my HR person always makes that sound really good. So yeah, sounds great, right?
Until you see the price tag. With COBRA, you pay your share plus whatever your employer was paying, plus a little administration fee. It was going to be something like $1,800 a month just to keep what we had.
That was a hard pass from us. I mean, $1,800 a month just burns through your retirement egg pretty fast. So we had to look elsewhere. And prior to that, I think we were paying like $300 a month. So to go from $300 to $1,800 a month.
Without an income.
Yeah, I mean, that just didn't make any sense for us.
Yeah. Our first stop outside the corporate world was a faith-based health sharing ministry. Now it's important to know this is not insurance.
It's a group of people pulling their money together to share medical costs. It's a lot cheaper than the traditional monthly insurance, like from a premium perspective.
Yeah.
And we used it for a while. I think what happened with us is I had a job up until that point and then I retired from it and we had a buffer period where we had already made too much money to qualify for the ACA plans. So that was kind of what we had to work with. And it felt like a good safety net, I would say.
Yeah.
For the really big stuff.
Yeah, and especially because it cost, you had $1,800 for COBRA and this was like $600 a month.
Yeah.
But there are a lot of rules with it. They don't have to cover pre-existing conditions, there are lifestyle requirements, and there's no legal guarantee that they will pay all your bills. It worked for a season, like Jared was saying, but as we got a bit older, we wanted more certainty.
And I remember Amber several times being on the phone for a long time with their customer service, and it being a faith-based organization, they were very polite, but they really weren't very helpful, and they didn't really cover a lot of things that we thought would be covered.
We were
initially.
pregnant too at that point, and with that, so it was different.
And it was pretty frustrating, and just felt like a black hole as to what was covered and what wasn't. And we ended up getting into a lot of debates with them, and every time we pretty much lost, and they didn't cover the thing that we felt like should have been covered.
Right, because I think it is very much if you have like bigger medical bills, then it works.
But if you have
smaller regular bills, it doesn't. They don't really cover it because it's not like a major surgery or you don't have like cancer or something like that. So it's definitely, if you look into it, just make sure you do diligence with it.
So this led us to the Affordable Care Act Marketplace. This is real insurance, at least, unlike the previous option. And if your income is quite low in early retirement, then the government gives you a subsidy and it makes it incredibly cheap.
We were on an ACA plan, and honestly, with the subsidies, it was pretty good. We were paying very little per month for a great coverage because our realized income was low. We thought, this is it. This is the long-term plan. It's gonna work for us.
Yep, and then this happened.
And that income that Jared was talking about pushed us right off of the subsidy cliff. When we went to renew our ACA plan for this year, because our income looked high on paper, the premiums went from a few $100s to over $3,000 a month for a bronze plan with a massive deductible.
So we ran the numbers, and we're fairly healthy. Knock on wood, you never know what the future holds. But it made absolutely no sense for us to pay $36,000 in premiums, and then on top of that, we had on those particular plans, we had like a $16,000 deductible. So it just really didn't make sense to have both of those combined. And you know, with that deductible, it's before insurance even pays a dime. So
yeah. So we made the very difficult decision to go bare for this year. So we are self-insuring currently. So now we have to address the elephant in the room. This is risky. If one of us needs an appendectomy tomorrow, that's coming out of our pocket.
a lot of people think, oh, okay, I'll just go and get insurance at that point. If something catastrophic happens, I'll sign up then.
And that used to be impossible because insurance companies wouldn't cover pre-existing conditions.
Thankfully, under the current ACA laws, they do cover pre-existing conditions, and they also are not allowed to increase the rates as a result of that. I looked that up. That's a huge win that we have now, so that's great. You can't be denied for having cancer or diabetes, for example.
However, this is a massive but. You can't just buy insurance on a Tuesday because you got sick on a Monday. You generally have to wait until the end of the year for that open enrollment period.
Exactly. So our current strategy is essentially gambling that nothing happens massively, at least between now and then. Luckily, we're right at the end of the year, so I mean, we pretty much made it. But then in the next enrollment period, if you're in that position. So if something catastrophic happens in July, we would be on the hook for everything until January 1st.
It's not an ideal place to be, and we don't necessarily recommend it. Our plan is to manage our realized income better next year so we qualify for subsidies again and get back on an ACA plan. This is a temporary gap year for us.
So if you're looking at healthcare for early retirement, here's a summary of your realistic options.
Number one, the ACA Marketplace, which we talked about. If you can keep your taxable income low, this is usually the best route. It's real insurance with subsidies.
So option number two, like we talked about, health sharing ministries. They're cheaper, but remember, it's not real insurance and it has coverage limitations. Definitely read the fine print on that one.
There's three, the barista fire route. You can get a part-time job for the benefits just to bridge that gap to Medicare at age 65. And then there's the fourth option, going uninsured, like we have done in the past and are currently doing. And just so you know, like for us, we found out that the hospital that we use with their medical team, when you go uninsured in there, they'll cut the bill in half.
Yep.
So there is that option. You just kind of have to read the fine print with your medical team so that you know what you're up against too.
So our journey has obviously been all over the map, which has been a little painful for us, but helpful for you guys, and puts us in a position to give you real advice with real numbers, and we've really gone through it. So like Amber said, we're currently in probably the riskiest potentially option of these, and something we probably wouldn't recommend, but we are actively working to make a change next year to get some catastrophic coverage, probably through the ACA Marketplace, and at least that way we'll have some coverage for catastrophic things that could happen down the road, and we'll be able to sleep a little better at night.
So we want to know what you're doing. Are you using the ACA? Are you braving it without insurance? Drop a comment below on how you solved this puzzle.
If you found our transparency helpful, please hit that like button, subscribe to our channel, and keep an eye out for our future videos. We're going to keep an eye out. Keep an eye on your comments and your questions, and we want to gear our content towards
What
that
you guys want.
as our strategy. So we're definitely listening to you guys, and we're trying to get back to you and answer all your questions and incorporate that into our future videos.
Yep. So until next time.
Thanks,
See you later.
guys.
Bye.
Sully's in here. Smile.